Hi, my name is Joni, and today I want to show you a self-treatment technique that can be very useful in helping to soften up and loosen up our hip area. So what we're going to do is we're going to focus on treating your right hip. I'm going to have you bend your right knee up, and we're going to have you place this ball underneath your hip so that you're lying on top of it, right in the center portion of your bottom, so that you're on soft tissue as opposed to bone. And just take a couple nice breaths right down to where the ball is. Just so you can get a sense of an area that might feel tender, tight, or sore. You may need to shift the ball around a little bit or shift your body weight a bit to find that area of tightness or soreness. So it's okay to wiggle and roll around. Then once you find that spot, then you want to stay there, because it's gentle, prolonged pressure that helps our bodies to release and soften. Rolling feels good, but it doesn't give us long-term results. So once we find that area of tightness or tenderness and we're waiting there, waiting for the release, we can also use our breath to help facilitate the release. So breathe right to where you feel the ball, softly and gently. Breathing right to where you feel that tenderness. Letting your body soften over the ball and sink into the table or bed as you breathe out. It's important to keep the intensity gentle or keep the intensity low, because anything that feels like it's too much, our bodies will just brace against it or hold against it, and our fascial tissue will not release if our body's perceiving the intensity as a threat. So when it's soft and gentle, then our tissue can let go. So if we're in a spot that feels intense or feels a bit nasty, then it's okay to work around that area for a while as opposed to working on it directly. One of the ways that we can add to this self-treatment method is through the position of our knee, the knee that's bent. So what we're going to do is just shift your knee out to the side just a little bit. That's it. And just see how that changes the angle or the pressure of where the ball is. And just allowing your knee position to shift as much as you need to be able to find a second area of pain or tightness. This can also help to modify the intensity as well. So again, if it's too intense, you may need to shift the position of your knee a bit so that it's easy and it's gentle. We find it's most useful for when we're treating the right hip to have the right knee bent, and when we're treating the left hip to have the left knee bent up. So by waiting in the area long enough to get a few releases, you may feel the urge to let your knee drop out a little bit further to the side as your body lets go and as your tissue softens. So it's okay to let that happen and explore multiple positions in space regarding the position of your knee. And regardless of where our symptoms are, it's important to treat both sides of the body as opposed to just where we're feeling it, because so often it's tightness in other parts of our body that's contributing to or driving our core symptoms. So by just treating symptoms, we're missing the whole picture. So we want to be thorough, not only with our hands-on treatment with the therapist, but we want to be thorough when we're self-treating as well.